After the age of 70, something subtle changes in the world of healthcare. For most of your life, checkups, screenings, and tests felt like a safety net, a way to stay one step ahead of illness. But once you reach your 70s, the balance shifts. The body isn't the same, the risks aren't the same, and the value of certain tests isn't the same either. Yet many seniors continue receiving the exact same screenings they took in their 50s or 60s, even though those tests may no longer offer the same benefits. In some cases, they may even create confusion, anxiety, or unnecessary treatment. This isn't because doctors are careless. It's because medicine is built on caution. When symptoms appear, tests are essential. But when you feel well, when nothing is wrong, when the test is ordered simply because it's that time of year, the results can become misleading. Harmless age-related changes appear on a screen and are interpreted as problems. Numbers that naturally shift with age look like risks. Before long, a senior who felt perfectly fine becomes caught in a chain of appointments, medications, and follow-up scans that don't make their life better, and sometimes make it harder. That's why understanding which tests truly help after 70, and which ones may cause more harm than good, is one of the most important steps in staying healthy, independent, and confident. A test should improve your life, not complicate it. A test should clarify, not confuse. And not all tests meet that standard in old age. The first checkup that many seniors undergo automatically, often without questioning its usefulness, is the bone density scan, also known as a DEXA scan. On the surface, it seems harmless, it's quick, painless, and doesn't require any preparation. You lie on a table, a scanner passes over your hips and spine, and the machine prints out a number meant to tell you how strong or fragile your bones are. The problem begins with what happens next. For people over 70, nearly everyone will show some decline in bone density. It's a part of normal aging, just like wrinkles or thinning hair. Bones gradually lose mineral content over time, and strength naturally decreases. But in seniors who have never fallen, never fractured a bone, and feel steady on their feet, a low reading often leads to aggressive treatment, even when the real risk of breaking a bone is low. Medications commonly prescribed for bone loss can have significant side effects: digestive irritation, inflammation in the esophagus, and rare but serious problems like jawbone damage are all documented risks. For someone who has never fractured a bone and isn't experiencing symptoms, the potential downsides of these medications may outweigh the benefits. That's why many experts advise focusing first on lifestyle, resistance exercises, better balanced training, vitamin D, and calcium-rich foods. For many older adults, these approaches offer meaningful improvement without medication. Yet seniors often feel pressured to act immediately. A number on a printout can feel frightening. Words like osteopenia or bone loss can make even a healthy person believe something is wrong. But those labels don't always reflect danger. Sometimes they simply reflect age doing what age naturally does. One woman who experienced this firsthand is Rose, a 76-year-old retired piano teacher. Rose lived an active life. She cooked, gardened, walked daily, and had never suffered a fracture. During a routine checkup, her doctor suggested a bone density scan. Just to be safe, she hadn't expected anything unusual. But when the results came back showing mild bone loss, she felt an instant wave of fear. She imagined brittle bones, sudden falls, a future of limitations she had never considered. Her doctor prescribed a medication meant to strengthen bone density. At first, she took it without question. But within a few months, Rose developed severe acid reflux and a strange discomfort in her jaw when she chewed. She stopped playing piano because holding certain postures triggered the pain. Living cautiously replaced living joyfully. When she finally sought a second opinion, she learned something surprising. Her level of bone loss was mild, typical for someone her age, and not considered dangerous. She didn't need medication. She needed movement, small weights, balance exercises, and vitamin D. After transitioning to a routine built around those habits, her strength returned, the pain eased, and she regained confidence in her body. Rose's story is far from rare. Many seniors are treated for mildly decreased bone density, even when the treatment provides little benefit. The intention is good, to prevent fractures. But the evidence shows that medication for mild bone loss in older adults rarely changes fracture outcomes meaningfully. On the other hand, improving muscle strength, balance, and nutrition significantly reduces fall risk, which is the real source of fractures. A bone density scan is still valuable for seniors who have fallen, those who are frail, or those who take medications that weaken bones. It remains an important tool when symptoms are present. But for healthy, active adults over 70 with no risk factors, repeating this scan regularly often adds more fear than clarity. It assigns a label to a natural process, and once that label is applied, treatment often follows, even when the body doesn't actually require it. Understanding this helps seniors approach testing with confidence instead of fear. Not every scan is necessary. Not every number needs correcting. Sometimes, the best medicine is a calmer approach, one that respects how the body changes and focuses on strengthening what matters most: function, balance, mobility, and independence. And as we move forward to the next screening, one that many seniors request out of worrying about memory loss, it becomes even clearer how easily a well-intended test can create confusion instead of comfort. Memory changes can feel unsettling after 70. A misplaced item, a forgotten name, or a moment of hesitation can suddenly seem frightening. These small lapses are usually harmless, yet many seniors worrying they signal something serious. Out of caution, doctors often order a brain MRI. The intention is good, but the result is not always helpful. In older adults, brain MRIs almost always show small white spots or mild shrinkage. These findings sound alarming, but they are normal for a person in their 70s or 80s. They do not mean disease, they mean age. The problem is that once a scan shows something, even if it is harmless, fear takes hold. Words like abnormality or age-related change can create confusion. A senior who felt mostly fine may begin questioning their memory, their independence, and even their future. And fear often makes memory feel worse, creating a cycle that never needed to begin. One example comes from George, a 74-year-old retired engineer. He noticed mild forgetfulness, nothing unusual, just the kind of slips most people his age experience. His doctor ordered an MRI to be safe. The scan showed small white matter spots, typical for his age. Even though his doctor reassured him, George fixated on the report. He convinced himself he was declining. His anxiety grew, and the stress made focusing harder. Months later, a simple cognitive screening showed his memory was perfectly normal. What he needed wasn't imaging. He needed reassurance, better sleep, and a calmer mind. His symptoms improved without another scan. That's why experts recommend a cognitive test first for mild memory complaints. It measures actual brain function rather than age-related markings on a picture. MRIs remain crucial when symptoms are severe or unusual, such as sudden confusion, rapid decline, or neurological changes. But for everyday forgetfulness, imaging often adds more worrying than clarity. A similar issue appears with another common screening, the cardiac stress test. This test checks how the heart responds to exertion. For people with clear signs of heart disease, chest pain during activity, shortness of breath at rest, or fainting, it is an essential tool. But many seniors receive stress tests simply because they feel tired or slower than they once did. And in those situations, the test can create more problems than it solves. As people age, their heart and blood vessels respond differently to exercise. Because of this, stress tests can produce false positives, results that look abnormal even when the heart is healthy. A false alarm often leads to more testing, including angiograms or stents, that may not improve symptoms for people without real heart disease. These procedures come with risks, especially for older adults, reactions to contrast dye, bleeding, or extended hospital stays. Raymond's experience shows how easily this can happen. At 75, he was active, walking daily. He occasionally felt tired on steep hills, which is common for someone his age. His doctor ordered a stress test to be cautious. The results were unclear, so he was sent for a catheterization. A small narrowing was found, and a stent was placed even though he had no dangerous symptoms. The procedure temporarily affected his kidney function, and he spent several days in the hospital. His fatigue did not change because it was never a heart problem. He simply needed more rest, hydration, and pacing during exercise. Stress tests remain life-saving when symptoms are genuine, but when ordered for vague complaints, they can lead to unnecessary intervention. A resting ECG or a discussion about lifestyle, often a safer first step. What both of these tests reveal is a larger truth about aging. After 70, the goal is no longer to look for every possible abnormality. The goal is to focus on meaningful information, tests that truly guide treatment, improve comfort, or protect quality of life. Not every scan makes life better, not every number matters, and sometimes choosing fewer tests is the choice that protects your health the most. Understanding this can free seniors from the fear that every small symptom is a major investigation. It helps build a more thoughtful, balanced approach to healthcare, one where decisions come from clarity, not worrying. And this brings us to the next test, one nearly every senior knows well. A test that becomes less useful and more risky as the years go on, the routine colonoscopy. Among all the routine checkups seniors receive, few are as well known or as misunderstood as the colonoscopy. For decades, it has been considered one of the most important screening tools in medicine. And for adults in their 50s and 60s, it truly is. Colonoscopies have saved countless lives by detecting dangerous polyps before they turn into cancer. But once you pass 70, especially if you've already had several normal screenings, the balance between benefit and risk begins to shift. The colon is not the same at 70 as it was at 50. The tissue is more delicate, recovery is slower, and even the preparation process, which younger adults often tolerate without much trouble, takes a heavier toll on older bodies. Strong laxatives used during prep can cause dehydration, dizziness, or sudden drops in blood pressure. The sedation used during the procedure can temporarily affect memory and balance. And the procedure itself, while usually safe, carries a higher risk of complications with age, such as bleeding or small tears in the bowel. None of this means colonoscopies are bad. They remain critically important for seniors with symptoms. But for older adults without symptoms, especially those who have already had one or two clean colonoscopies earlier in life, repeating the test automatically may not be necessary or beneficial. Imagine a 73-year-old who has had multiple normal colonoscopies and has no digestive symptoms. Their chance of developing a dangerous polyp that grows quickly enough to cause problems is quite low. Meanwhile, the risks associated with the preparation, sedation, and procedure are higher at this stage of life than they once were. In these cases, the question becomes not is the test useful, but is the test still valuable enough to justify the risks? This is the situation Dana found herself in. Dana was a 73-year-old grandmother who worked part-time in her family's bakery. She enjoyed staying active, had no gastrointestinal symptoms, and had two normal colonoscopies earlier in life. At a routine appointment, her new doctor recommended repeating the screening. Dana trusted the advice. She went home, prepared for the test, and completed the procedure the next day. A small, slow-growing polyp was removed during the exam. The doctor told her it looked harmless, but still needed to be sent for analysis. That night, Dana began feeling intense abdominal pain. Something wasn't right. She fainted in her kitchen, and her daughter rushed her to the hospital. Tests revealed a small perforation, a tiny tear in the wall of her colon, a known but uncommon complication. She underwent treatment, spent more than a week recovering, and lost strength she spent months working to regain. The final verdict? The polyp removed was benign, something that posed no immediate danger and might never have required treatment. Dana's experience illustrates a quiet truth. Colonoscopies are powerful tools, but they are not always the right tool, especially for healthy seniors with no symptoms and prior normal results. In many cases, a safer alternative exists, a simple stool-based test. These tests, often done at home, check for a hidden blood or markers that might indicate risk. They require no preparation, no sedation, and no clinic visit. When used consistently, they can detect early warning signs just as effectively for many older adults. The decision to continue or stop colonoscopy screening shouldn't come from fear or habit. It should come from a clear understanding of your previous history, your current health, and your personal risk level. For seniors in good health, but without symptoms, many guidelines recommend stopping routine colonoscopy around age 70–75. That doesn't mean giving up prevention. It simply means shifting to safer, less invasive tools. There is another layer to this conversation that often gets overlooked: the emotional impact of unnecessary screening. When a senior goes through a colonoscopy simply because it was recommended without context, they may be left with worrying, fatigue, or fear. They may begin to see their body as fragile or unpredictable, even when they are healthy. But when testing is done thoughtfully, when it is truly needed, it reinforces confidence rather than undermining it. A colonoscopy remains the right choice when symptoms appear: blood in the stool, persistent changes in bowel habits, unexplained weight loss, or pain that won't go away. These are signals that demand attention. In those cases, a colonoscopy is not just helpful, it is essential. It identifies the cause, guides treatment, and protects long-term health. But when symptoms are absent, when previous screenings are normal, and when age increases the risks more than the benefits, it becomes important to consider alternatives. Prevention doesn't disappear. It simply becomes smarter, gentler, and more tailored to the aging body. As we move through the 70s, healthcare becomes less about finding every tiny abnormality and more about protecting quality of life. The goal is to avoid harm, avoid unnecessary procedures, and avoid fear-based decision-making. It is to focus on tests that offer meaningful information and skip the ones that don't. And this brings us to one final test, a test many seniors undergo, because they need it, but because it is marketed as a complete or thorough evaluation. A test that sounds reassuring at first, but can lead to a cascade of anxiety and procedures that never needed to happen. It is the whole-body CT scan, and it may be the most misleading screening of all. Among all the tests seniors encounter, none sounds more reassuring or more misleading than the whole-body CT scan. It is often marketed as the ultimate preventive checkup, a way to look inside everything, to find hidden problems before they become dangerous. The idea feels comforting, especially to older adults who want to stay ahead of illness. But the promise behind these scans doesn't match the reality. For people over 70, full-body CT scans rarely improve health outcomes, and in many cases, they create far more problems than they solve. A CT scan uses powerful imaging technology to take cross-sectional pictures of the body. It is a remarkable tool when used for a specific purpose, to diagnose unexplained pain, detect an infection, or guide urgent treatment. But when used without symptoms, as a broad screening tool, it becomes less about clarity and more about confusion. And for older adults, the risk of false alarms is high. This is because the aging body naturally develops harmless features that CT scan cannot interpret contextually. Tiny cysts, calcium deposits, benign nodules, age-related changes in organs, all of these can appear concerning on the screen even when they are not dangerous and require no treatment. Once something unexpected is spotted, even if it poses no real threat, it triggers a chain reaction, follow-up scans, specialist visits, and sometimes invasive procedures designed to investigate a finding that never needed investigating in the first place. This cascade is not rare, it is a pattern, and it can take a toll on an older adult's health, energy, and peace of mind. Marcus, an active 80-year-old who taught martial arts to other seniors, experienced this firsthand. He felt healthy, kept a regular exercise routine, and simply wanted reassurance that his body was in good shape. During a wellness event, he saw an advertisement for a private full-body scan. It sounded promising: one scan, complete information, total peace of mind. He booked the appointment without hesitation. The scan revealed a tiny lung nodule, just a few millimeters wide. The radiologist wasn't certain what it meant. Most nodules that size in older adults are harmless, often little scars from past infections. But once it appeared on the report, the recommendation was clear: more imaging. Marcus was sent for a second scan, then referred to a specialist, and eventually underwent a needle biopsy to rule out anything serious. The biopsy found nothing dangerous. The nodule was benign, exactly what most nodules are. But the procedure caused a small collapse in one section of his lung, a known complication, and he spent days in the hospital recovering. The original scan had not protected him. It had led him into a medical process he never needed, one that left him weaker than before. Stories like Marcus's highlight a simple truth: full-body CT scans are powerful, but power is not the same as benefit. Without symptoms, these scans do not improve health outcomes. They do not make seniors live longer. They do not reliably catch cancer early, but they do expose the body to radiation, which accumulates over time, and they often uncover incidental findings that complicate life rather than help it. This doesn't mean CT scans are bad, far from it. When a senior has concerning symptoms, persistent cough, unexplained weight loss, abdominal pain, or bleeding, a targeted CT scan can be life-saving. But scanning the entire body without a reason is like fishing in a lake with a giant net. You pull up everything, including things that don't matter, and suddenly every harmless object becomes a potential problem. As people grow older, the philosophy of healthcare changes. Prevention is still important, but prevention looks different when the body has decades of history behind it. The goal is no longer to look for every tiny irregularity. The goal is to prevent harm, avoid unnecessary procedures, and support the parts of the body that truly affect quality of life, mobility, strength, balance, memory, mood, and everyday function. This shift also means asking better questions before agreeing to tests. Instead of asking, "What if this finds something?" seniors can ask, "What will this test change?" If the answer is unclear, if a test is unlikely to improve treatment, comfort, or safety, it may not be worth doing. A good test leads to a good plan. A confusing test leads to more confusion. A thoughtful approach to testing doesn't weaken healthcare. It strengthens it. It focuses time, energy, and resources on the things that truly matter. It avoids the cycle of unnecessary tests, unnecessary follow-ups, and unnecessary fear. And so, after reviewing these 5 common checkups, the message becomes clearer. Aging is not about chasing every possible diagnosis. It is about choosing wisely, living steadily, and using healthcare in a way that preserves independence rather than complicates it. Good healthcare after 70 isn't defined by the number of tests you take. It's defined by the clarity of the choices you make. Tests should protect you, not overwhelm you. They should answer real questions, not create new ones, and they should always be guided by symptoms, history, and individual needs, not routine or pressure. The real strength in aging comes from understanding your body, asking questions, and choosing tests that genuinely support your health. It comes from lifestyle, moving often, eating well, sleeping deeply, staying hydrated, nurturing friendships, and staying mentally engaged. These habits do far more for long-term health than any broad scan ever could. And perhaps the most important truth is this: feeling safe does not come from taking more tests. It comes from learning which tests truly help and letting go of the ones that don't.